Cancer is a complex disease. It can be difficult to diagnose and treat. Tumor markers are substances found in the blood, urine, or body tissues. They can help doctors diagnose cancer. Tumor markers are like clues. High levels of a tumor marker can suggest the presence of cancer. However, not everyone with cancer will have elevated tumor markers. Tumor markers are not perfect. They can be elevated in non-cancerous conditions too. Therefore, they are used in conjunction with other tests like biopsies and imaging scans. By understanding tumor markers, doctors can make more informed decisions about diagnosis and treatment. Carcinoembryonic antigen, or CEA, is a specific type of tumor marker. Tumor markers are substances, often proteins, produced by the body in response to cancer growth or by the cancer tissue itself. They can be found in the blood, urine, stool, tumor tissue, or other tissues and bodily fluids of some patients with cancer. CEA is a protein found on the surface of some cancer cells. It is not only present in cancerous cells but can also be found in smaller amounts in normal cells. However, its levels are significantly higher in cancerous conditions. CEA is primarily associated with colorectal cancer. This means that it is most commonly elevated in patients suffering from this type of cancer, making it a useful marker for diagnosis and monitoring. However, it can also be elevated in other cancers like lung, breast, and pancreatic cancer. This makes CEA a versatile marker, though it is not specific to any one type of cancer, which can sometimes complicate diagnosis. The discovery of CEA dates back to the 1960s. It was a groundbreaking finding in the field of oncology, providing a new tool for cancer detection and management. Researchers found high levels of CEA in the blood of patients with colorectal cancer. This correlation between elevated CEA levels and cancer presence was a significant step forward in understanding how to use biomarkers in cancer care. This discovery paved the way for using CEA as a tumor marker. It allowed for the development of blood tests that could help in the early detection of cancer, monitoring of treatment effectiveness, and checking for cancer recurrence. Today, CEA plays a significant role in managing various cancers. It is used not only in the initial diagnosis, but also in monitoring the progress of treatment and in follow-up care to detect any signs of cancer returning. It helps doctors make informed decisions about diagnosis, treatment, and follow-up care. By tracking CEA levels over time, healthcare providers can adjust treatment plans as needed, ensuring the best possible outcomes for their patients. This makes CEA an invaluable tool in the ongoing battle against cancer. Colorectal cancer is a serious disease that affects the colon or rectum. Early detection of colorectal cancer dramatically increases the chances of successful treatment. CEA is a valuable tool in the fight against colorectal cancer. Elevated CEA levels can be an early warning sign of this disease. While CEA is not a foolproof test, it provides valuable information. Doctors consider CEA levels along with other factors like symptoms and diagnostic tests. By monitoring CEA levels, doctors can assess the effectiveness of treatment and detect any potential recurrence of the cancer. Smoking is a major risk factor for several types of cancer, including lung and colorectal cancer. The harmful chemicals in tobacco smoke can damage the cells in your lungs and other parts of your body, leading to mutations that can cause cancer. It's important to understand how smoking affects your health and the various ways it can increase your risk of developing serious diseases. Interestingly, smoking can also elevate CEA levels, even in the absence of cancer. Carcinoembryonic antigen, or CEA, is a protein that can be found in higher levels in individuals who smoke. This elevation can sometimes lead to confusion in diagnosing cancer, as high CEA levels are often associated with malignancies. Smokers tend to have higher baseline CEA levels compared to non-smokers. This is because the body reacts to the constant exposure to harmful substances in tobacco smoke by producing more CEA. This natural response can complicate the interpretation of CEA test results, making it essential for healthcare providers to have a comprehensive understanding of a patient's smoking history. This difference makes it crucial for doctors to consider smoking history when interpreting CEA test results. By taking into account whether a patient is a current smoker, former smoker, or has never smoked, doctors can make more informed decisions about the patient's health and potential cancer risk. For smokers, quitting smoking can lead to a decrease in CEA levels over time. As the body begins to heal from the damage caused by smoking, CEA levels can gradually return to normal. This reduction in CEA levels is one of the many benefits of quitting smoking, alongside improved lung function and a lower risk of developing cancer. This decrease highlights the positive impact of quitting on overall health and reducing cancer risk. Quitting smoking not only lowers CEA levels but also enhances overall well-being, leading to a healthier and longer life. The journey to quit smoking can be challenging, but the health benefits are well worth the effort. Doctors always consider a patient's smoking status when interpreting CEA levels. This practice ensures that the test results are viewed in the correct context, allowing for a more accurate assessment of the patient's health. This consideration ensures a more accurate assessment of their cancer risk. By understanding the impact of smoking on CEA levels, healthcare providers can better evaluate the likelihood of cancer and provide appropriate guidance and treatment to their patients. Section 5. Testing for CEA, a simple blood draw. Testing for CEA is a straightforward process involving a simple blood draw. No special preparation is usually required before the test. The blood sample is analyzed in a laboratory to determine the concentration of CEA in the blood. Results are typically available within a few days. Normal CEA levels vary slightly depending on the laboratory. However, higher CEA levels generally raise concern and warrant further investigation. The ease and convenience of CEA testing make it a valuable tool for both screening and monitoring cancer. Section 6. Monitoring treatment, CEA as a guidepost. Carcinoembryonic antigen, or CEA, is a protein that can be found in higher levels in some cancer patients. It serves as a crucial biomarker in the ongoing battle against cancer. CEA levels can be used to monitor the effectiveness of cancer treatment. By regularly measuring these levels, healthcare professionals can gain valuable insights into how well a patient is responding to their prescribed therapy. If treatment is successful, CEA levels should decrease over time. This decline is a positive indicator, suggesting that the cancer cells are being effectively targeted and destroyed by the treatment regimen. Doctors closely monitor CEA levels throughout the course of treatment. This continuous monitoring allows them to detect any changes early and adjust the treatment plan accordingly. This monitoring helps them assess how well the cancer is responding to therapy. It provides a dynamic picture of the patient's progress, enabling more personalized and precise care. If CEA levels remain elevated or start to rise again, it could indicate that the cancer is not responding well to treatment or that it has recurred. This information is critical for making timely decisions about potential changes in the treatment approach. By tracking CEA levels, doctors can make adjustments to the treatment plan as needed to optimize outcomes for their patients. This proactive approach ensures that the treatment remains effective and that any signs of recurrence are addressed promptly. The use of CEA as a guidepost in cancer treatment exemplifies the importance of biomarkers in modern medicine, providing a pathway to more effective and personalized care for patients battling cancer. Section 7. Detecting recurrence, CEA's early warning system. Even after successful cancer treatment, there is always a risk of recurrence. CEA serves as an early warning system for detecting potential recurrence. Regular monitoring of CEA levels after treatment allows doctors to detect any recurrence early on. Early detection of recurrence is crucial as it allows for prompt intervention and potentially better treatment outcomes. While an increase in CEA levels does not always mean the cancer has returned, it prompts further investigation to rule out recurrence. Section 8. CEA in other cancers, a wider scope. While CEA is most commonly associated with colorectal cancer, it can also be elevated in other types of cancer. Elevated CEA levels can be found in cancers of the lung, breast, pancreas, ovary, and stomach. The level of elevation varies depending on the type and stage of cancer. In these cancers, CEA may not be used as a primary screening tool. However, it can still be helpful in monitoring treatment response and detecting recurrence. The versatility of CEA makes it a valuable marker in the management of a variety of cancers. Section 9. The limits of CEA, not a standalone test. It is important to note that CEA is not a perfect test. It has limitations and should not be used as a standalone diagnostic tool for cancer. Elevated CEA levels can occur in non-cancerous conditions such as inflammatory bowel disease, pancreatitis, and even smoking. Conversely, some people with cancer may not have elevated CEA levels. Relying solely on CEA could lead to misdiagnoses or unnecessary anxiety. CEA is most effective when used in conjunction with other tests and clinical information. Section 10 Conclusion. CEA, a valuable tool in cancer care. Carcinoembryonic antigen, CEA, is a valuable tumor marker that plays a crucial role in managing various cancers. While it is not a perfect test, it provides valuable information to healthcare providers. CEA helps detect colorectal cancer, monitor treatment response, and detect potential recurrence. Understanding CEA levels empowers both doctors and patients in making informed decisions about cancer care. As with any medical test, it is essential to consult with a healthcare professional to interpret CEA results and discuss their implications. Section 11. Disclaimer. The information provided in this essay is intended for general knowledge and informational purposes only, and does not constitute medical advice. It is essential to consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.